Hi, everyone. My name is Ashley Ann Robinson. I'm a NICU nurse from my organization. I wanted to talk to you guys today about my integrated practice project, in which consisted of basically developing a program for preventative care measures for neonates. For those of you that know a little bit about the population, you know that this is a very fragile population and that we do not want to introduce any sort of infectious agents to them because they don't have much of a immune system. So my goal was to create a handout promoting the importance of preventative care measures for the neonatal population. My targeted audience included caregivers, staff members, as well as families of caregivers. I also wanted to focus on the implementation of parents and caregivers and staff members of implementing protocols such as obtaining flu vaccinations, screenings for sick parents and staff members and children, as well as both staff and family members staying home when they're sick. I feel like that we as nurses sometimes get so focused on coming to work because we know we're short staffed when we forget that introducing an infectious agent to this particular population could be very detrimental to this population. So my focus was to prevent this by introducing these preventative measures. So by module 1, I met with my leadership team. I gave them all of my evidence-based research articles and collaborated with them to let them know that I would be formulating a brochure in which consisted of preventative care measures needed in order to improve patient outcomes. The leadership management team, consisted of about 5 members, about 2 team leaders, 1 patient care manager, and a couple of nurses. So by module 2, I had created the brochure. I've actually already handed all of these out, but I have a copy. So this is the brochure. It basically insisted on practices such as hand washing. It had a bunch of CDC guidelines such as patients obtaining flu shots for the caregivers obtaining flu shots for the population that couldn't obtain the flu shots, which is our neonatal population of children 6 months and younger. So, overall, I felt my parents were intrigued by Module 3. I was able to introduce this brochure and as well as a questionnaire to my patients and caregivers and staff members. They also seemed to respond well to the survey. Basically, I just wanted to assess the likelihood of them implementing the practices that we talked about. And I also had a few trivia questions for them. I don't know if you guys can see that, in which consisted of just wanted to measure the educational outcomes as far as how much knowledge they gained from the actual program. And so by Module 4, I was able to, from the 20 participants, collect data. I separated the data based on staff versus caregivers because I wanted to distinguish the difference between the two. So my staff members actually consisted of a broad population of staff members. I had patient care techs, secretaries, respiratory techs, as well as nurses. I wanted to do that just to focus on the bigger picture that everybody delivers care in the NICU and that we as a team need to refocus our practice, not just nurses. So what I concluded was that 50% of the staff members were less likely to return to work while they were sick. 10% were more likely to utilize alcohol-based rub appropriately, and 30% of staff members, with regard to advocacy for hand hygiene and patient illness, were more likely to advocate for that. So within my neonatal population, however, I had a 40% success rate of advocacy for good hand hygiene, as well as parents recognizing that they should stay at home when they were sick. And they were also 40% more likely to obtain their flu vaccination. So I was very excited about that. I also had 100% compliance with regard to my trivia. So all my patients, caregivers, and their families and my staff members got their questions right. So I was intrigued by that. So by module 5, I pretty much reviewed the information with my team members, and we decided to distribute the rest of the brochures. So by week 6, I was able to integrate this knowledge into my journals, and I feel like overall the program was a success, and we did a great job, and we saw some great improved patient outcomes. So I'm very excited about the success of the program, and I wish you all well. Thank you.